So what are the types of hip replacement? People do ask me, are you going to do Andy Murray's resurfacing? And I'll say, no, we're not, because it does lead to a few insoluble problems in the selection of patients, and we prefer to avoid it because we have tried and tested solutions that provide you with a 20-year solution that'll give you a great result. If you're going to do a hip replacement on a 20-year-old who wants to achieve world-class athletic pursuits, then okay, you have to discuss slightly different solutions. But for the majority of people who are over the age of 50, a traditional hip replacement gives you a lovely result. But people do ask, well, what about the materials? What should I have? Should it be metal, plastic, ceramic? Should it be cemented or uncemented? Well, if you are an engineer, you want a bearing surface that leads to the least amount of debris and lasts the longest possible time. And we've done a lot of work where we have jigs, where you have bearing couples inside bovine serum, and you go through millions and millions of cycles of joint loading. And you discover how well these joints will actually do over 5, 10, 20, or even 30 years of use. And what we find is the best couple from the point of view of debris is ceramic on ceramic. It's a very hard surface and it provides very little debris. However, occasionally ceramic, which is a very hard, brittle structure, can fragment. And if it fragments, it creates a very difficult problem to solve because the ceramic debris is an irritant to the surrounding soft tissues, and it's very difficult to get rid of that irritant when you have to do the revision hip surgery. So it's something that you carefully select and choose the right patient for ceramic. Probably a safer bearing couple, and recently in the Hip Society, there was a show of hands from the members of the audience who are all orthopedic surgeons, and it was suggested, what would you like if you were going to have a hip replacement? And the couple that most of them went for was what's called hard on soft, which is ceramic on polyethylene. That is a more forgiving couple, doesn't tend to lead to the ceramic debris that you get from ceramic on ceramic, and it's probably going to lead to probably the potential of 20 to 30 years of good use before you get unacceptable debris being produced at the bearing site. Metal on plastic is the most established couple that we have, and we tend to go for that if you want the safest possible hip replacement in people that in general are aged in their 70s plus, because we know it is going to last for 20 years. Ceramic on poly, we are probably looking at 30 years life. But this is all theoretical, because what really matters is the interface of the component with the bone, because that's where a hip replacement fails. You get loosening of that interface. The reason you get loosening is because there's a slight mismatch in the stiffness of any form of metal component and bone, which is a biological structure that's changing its density and its stiffness with the aging process. And when you get a big mismatch, you can get loosening. But the debris from the bearing surface can also contribute to this loosening. So really, when it comes down to it, rely on the surgeon's preference as to what is going to be the bearing couple, because there is very little difference between the couples we use nowadays. They're all pretty good. And whether you use cement or uncement, again, is down to surgeon's preference, really, whichever fits well with their technique of hip replacement surgery. If you go into the National Joint Registry, it will give you some fine nuances and differences between them, but honestly, they're all pretty good.